Okay, so in this video, we're going to talk about shoulder joint injuries. And the first type of injury we're going to talk about is the acromial clavicular separation, also known as an AC separation, also known as a shoulder separation. So the AC joint is made up of the acromion process of the scapula and the clavicle, which is the collarbone. So let's take a look at those. Okay, and so now if we look, you can see this is the scapula once again. And if we look, this is looking at the scapula from the back. This is the posterior view. And in case you're wondering, once again, the scapula is your shoulder blade. So this is looking at it from the back. So if you remember, we talked about the infraspinatus muscle, that would be in here. My teres minor would be up in here. My supraspinatus muscle was up in here. This is looking at it from the front. So this is my subscapular fossa. For those of you who had anatomy, my subscapularis muscle is here. And if we look, you can see over in here, we have our acromion process. So the acromion process, if you look, is actually on the back of this thing. And it sticks out to the side. So the spine, the spinal column would be over in here. If for this scapula right here. All right, so my arm would be out over this way. Okay, this would be the arm. Okay, and then this is just looking at it straight on. So if you can see, we're looking at the scapula or the acromial process right here. So that's the acromial process. Now you got to figure what's going to happen is I am going to have the collarbone come and attach, not necessarily attached, but almost attached right next to this acromion process right here. So let's take a look at that. And so if we look right here, you'll see this is my collarbone again. This is the clavicle, right? The clavicle starts with a C, acromion. Here's my acromion that's over in here again. And I have an acromion on each side. So I also have the acromion over in here. Acromion starts with A, so they call this the AC joint. And you have one on each side. So if we look, boom, this is the AC joint. That's right here. And now if we look here, this is a better view of it. Here's my acromion once again, like it says here. There's my acromion, and there's my clavicle, and right here is my AC joint. So as you can see, they're close, but they don't necessarily touch. And the reason for that is because by these not being a solid bone or by actually fusing together, it allows for more range of motion of the shoulder. And although this is kind of blurry to see, the only reason I put this in here is I want you to see that you actually have a ligament that connects these two bones together. It's called the acromial clavicular ligament, and it surrounds the AC joint. So that's the only reason I have this in here, so you can see there's a ligament there, and that's not just sticking out there by itself. So now that we know what the acromion process is made up out of, let's talk about AC joint separation. So the AC joint separation is when the joint between the acromion and the clavicle is separated. Separations can occur due to trauma in football, hockey. Let me stretch this out a little bit. Hockey, or falling down on the shoulder. And normally it's not going to look that bad. It's just going to look like somebody just fell and landed on their shoulder. But because of the fact that the shoulder's hitting the ground and the rest of the body above it's still moving, you'll tear that acromioclavicular ligament or stretch it out, and that allows for the separation. Symptoms of pain is pain reaching overhead or sleeping on the affected side. Sleeping on the affected side should be obvious because it hurts already, right? Reaching up overhead, because when you reach overhead, you actually rotate the scapula, and as you rotate it, you're going to stretch on those ligaments, and that will cause more pain. So if you have pain reaching overhead or sleeping on one side, you may have an AC joint separation. The difference is there will be trauma. So if you have a shoulder that's hurting right now and you're thinking, oh my gosh, when I lay on my side, my shoulder hurts, unless you have trauma to go with it, chances are it's not an AC joint separation. So let's look at some x-rays. Okay, and this is a normal AC joint right here. Let me see if I change this to white. And let me go back here real quick. Okay, so if we look, this is my AC joint right here. And you'll see, like I said, there's a little bit of space that's in there, and this is surrounded by ligaments. So this is what a normal looks like. That's a normal AC joint. And so now let's say the person falls on it and it separates. We're going to look at the 3 phases. Okay, so let's take a look at the 3 phases of an AC joint separation. And in grade 1, the ligaments are stretched, but the joint is still lined up. It shouldn't say and. And the joint space may be normal. Okay, so let's go ahead and take a look. So once again, this was my normal. We're going to be looking at the other side for the separation. So that's my normal. And then there's a little bit of joint separation here. And again, this can look totally normal on x-ray. And I bet you would even get people to argue whether or not this was actually a separation here. Even though it is separated, it's an AC joint separation. It's so small, you may not even notice too much about it. So this is a grade 1. Okay, I'm going to see if I can write this. Grade 1 separation. Basically what would have to happen on this is would have to go along with the history. Treatment for this, ice, and then just some rest. Don't avoid whatever activities may injure it. Pretty simple treatment for grade 1. Would not require surgery. If it requires surgery, it's most likely not a grade 1 separation. A grade 2 separation is some tearing and minor dislocation of the ligaments. Okay, so we have you might see a little bit of this on an x-ray. Let's take a look. Okay, and then once again, this is the normal. Okay, so here's the normal again. You can see how small that joint space is. And then on a grade 2, what's going to happen is you can see the separation here. That's my grade 2 separation. So now you can see there's actually some space that's in there. For reference, okay, remember, this is how big the space was on the last one, and this is how big the space is on this one. Okay, so that's going to be a grade 2. And grade 2, most of the time, it's the same thing. You're just going to need more time to rest. You put ice, you put heat, you do some exercises on it. After a while, you may be able to do some weightlifting with it, shoulder shrugs, things like that to help treat this. Okay, and then we're going to look at a grade 3 separation here. And as it says here, there's complete tearing of and the clavicle is so dislocated that displacement of the clavicle, you can see it on exam. Not only can you see, on exam, you'll see it on x-ray, but you'll also notice that something's sticking out from the top of the shoulder. The bone doesn't stick out through the skin usually, but you can see there's a big bump on top of the shoulder that will come with this. So these may require surgery most of the time. It's very unlikely that you can actually pop these back into place. Most of the time, they're probably going to require surgery. So like it says, grade 1 and 2 do not require surgery and heal within a few months, few days to months. These grades also apply to other sprain, strain injuries. So let's take a look. Okay, so once again, this is going to be my normal. That's my normal right there. No problems with that. And now let's look at our grade 3. So as you can see now, basically it's separated. It should be right about here, but you can see it's gone up this way. So that's my grade 3 separation. Again, this is the collarbone, this is the acromion right here, and this is a grade 3 separation. Lots of times these will require surgery. I don't know how often they wouldn't require surgery because this is usually pretty bad. When football players get these, they're usually out for a while. Okay, so this is it for our AC separations.